Hello everyone, welcome back to the channel. In this episode, we are going to be discussing an effective yet non-invasive treatment for depression called Transcranial Magnetic Stimulation, or TMS. If you're new here, welcome to the health sphere, where we provide health advice based on our own personal experiences, research, and what has worked for others. Keep in mind that we are not doctors, and that this information is for general knowledge and should not replace advice from your own healthcare professional. Now let's get into it. Have you heard of transcranial magnetic stimulation? This groundbreaking technology has shown promising results in treating depression without the need for medication or invasive procedures. In this video, we will delve into what transcranial magnetic stimulation is, how it works, its benefits over traditional treatments, and some of the potential risks involved. Whether you are personally struggling with depression or know someone who is, this video will shed light on a new and innovative approach to managing this complex condition. So stay tuned and join us on this informative journey. What is transcranial magnetic stimulation? Transcranial magnetic stimulation, often abbreviated as TMS, is a non-invasive and non-surgical treatment that has gained significant attention in the field of mental health. At its core, TMS involves the use of magnetic pulses to stimulate nerve cells in the brain, particularly those associated with mood regulation and depression. The procedure is carried out using a device that produces focused electromagnetic energy, which is then delivered to specific areas of the scalp. This energy penetrates the skull and stimulates the underlying brain regions, inducing electrical activity in the neurons. How does transcranial magnetic stimulation work? The exact mechanisms by which TMS exerts its therapeutic effects are still not fully understood, but several key theories have been proposed. One prominent theory suggests that TMS works by regulating the activity of certain neurotransmitters in the brain, such as serotonin, norepinephrine, and dopamine. These neurotransmitters play crucial roles in mood stabilization and have been found to be imbalanced in individuals with depression. By modulating their activity through magnetic stimulation, TMS is believed to restore the balance of these neurotransmitters and alleviate depressive symptoms. Another compelling theory proposes that TMS induces a neuroplastic response in the brain. Neuroplasticity refers to the brain's ability to modify its structure and function in response to stimulation. Studies have shown that TMS can promote the growth of new dendrites, which are branch-like extensions of neurons that facilitate communication between brain cells. By enhancing neuroplasticity, TMS may help to strengthen connections between neurons involved in mood regulation and cognitive processing, leading to improvements in depressive symptoms and overall mental well-being. Additionally, TMS has been found to stimulate the release of brain-derived neurotrophic factor, BDNF, which plays a vital role in neuronal survival, growth, and differentiation. Increasing BDNF levels through TMS may contribute to the restoration of normal brain function and the alleviation of depression. What conditions can be treated with transcranial magnetic stimulation? While TMS has shown remarkable success in treating major depressive disorder, its applications extend to other conditions as well. Clinical trials have demonstrated the efficacy of TMS in managing symptoms of obsessive-compulsive disorder, OCD, in patients who have not responded to traditional therapies. The repetitive nature of the magnetic stimulation helps to interrupt the cycle of obsessive thoughts and compulsive behaviors associated with OCD, providing relief to those who suffer from this condition. Furthermore, TMS has shown promise in the treatment of other mental health disorders such as post-traumatic stress disorder, PTSD, and bulimia nervosa. In cases of PTSD, TMS can help to reduce the frequency and intensity of flashbacks and distressing memories, allowing individuals to process and recover from traumatic experiences more effectively. Similarly, for bulimia nervosa, TMS may help to regulate the brain regions involved in appetite control and body image perception, leading to a reduction in binge eating and purging behaviors. Additionally, researchers are exploring the potential of TMS in treating conditions like addiction, ADHD, and chronic pain. While more studies are needed to establish its efficacy in these areas, the versatility of TMS as a therapeutic tool holds great promise for expanding its applications in the realm of mental and physical health. Is transcranial magnetic stimulation right for you? The decision to pursue transcranial magnetic stimulation as a treatment option should be made in consultation with a qualified healthcare professional. Several factors are considered to determine the suitability of TMS, including the severity and persistence of depressive symptoms, the presence of other mental health conditions, and the individual's overall physical and mental health status. It's important to note that TMS is generally considered safe and well tolerated. However, there are some potential risks and side effects that should be discussed with a healthcare provider. These may include scalp discomfort, headaches, nausea, dizziness, or muscle twitching. Additionally, individuals with certain medical conditions, such as epilepsy, may need to avoid TMS therapy. It's crucial to have an open and honest conversation with a healthcare professional to assess the potential benefits and drawbacks of TMS and make an informed decision about whether it is the right treatment option. The benefits of transcranial magnetic stimulation. Transcranial magnetic stimulation offers several potential benefits over traditional treatments for depression, making it an attractive option for many individuals. Firstly, TMS is a non-invasive and non-surgical procedure, eliminating the need for sedation, anesthesia, or incisions. This not only enhances patient comfort, but also reduces the risk of infection and other complications associated with invasive treatments. Additionally, unlike medication, TMS does not involve the use of drugs or chemicals, which can have numerous side effects and may require careful monitoring. Moreover, TMS is highly targeted, allowing for localized stimulation of the brain regions involved in mood regulation and depression. This precision helps to minimize the impact on other brain functions and reduces the likelihood of side effects that may occur when targeting broader areas. Furthermore, TMS is well tolerated by most patients, with many experiencing only mild and temporary discomfort during the procedure. It's also important to note that TMS does not cause seizures, even though it involves the use of magnetic pulses. Studies have shown that the stimulation parameters used in TMS are well below the threshold for seizure activity. Additionally, TMS has been shown to have long-lasting effects, with many patients experiencing a sustained reduction in depressive symptoms even after completing the treatment course. This durability of results makes TMS a valuable tool in the management of depression, offering hope for long-term recovery. Things to consider before getting transcranial magnetic stimulation. Before undergoing transcranial magnetic stimulation, it is essential to consider several factors to ensure a positive and successful treatment outcome. Firstly, it's crucial to consult with a qualified healthcare professional to discuss your medical history and current medications, including supplements and over-the-counter drugs. This evaluation will help determine your eligibility for TMS therapy and identify any potential contraindications. Additionally, it is important to have realistic expectations about the treatment. While TMS has shown remarkable results for many individuals, it is not a one-size-fits-all solution. Some patients may require multiple treatment sessions, and in some cases, TMS may not be effective. It's essential to understand that the success of TMS can vary and that ongoing treatment or alternative therapies may be necessary. Furthermore, it is crucial to inform your healthcare provider about any metal implants or electronic devices you have, as they may interfere with the magnetic pulses used in TMS. This includes pacemakers, defibrillators, and certain types of neurostimulation devices. Finally, it is important to note that insurance coverage for TMS can vary widely. It is recommended to contact your insurance provider prior to starting treatment to understand your coverage and any potential out-of-pocket expenses. By considering these factors and engaging in open communication with your healthcare provider, you can make an informed decision about whether TMS is the right treatment option for you. What are the alternatives to transcranial magnetic stimulation? While transcranial magnetic stimulation has emerged as a promising treatment for depression, it is essential to explore alternative options that may be suitable for individuals who are not candidates for TMS, or those who prefer to consider various treatment avenues. One alternative is electroconvulsive therapy, ECT, which has been used for decades to treat severe mental health conditions such as major depressive disorder and catatonia. ECT involves the use of electric currents to induce a brief seizure, which can help to alleviate depressive symptoms. While ECT has an established history, it is often considered after other treatment options, including TMS, have been explored. Another alternative is psychotherapy, which encompasses various forms of talk therapy aimed at exploring underlying emotional and psychological issues that may contribute to depression. Cognitive behavioral therapy, CBT, is a widely used therapeutic approach that focuses on identifying and modifying negative thought patterns and behaviors that perpetuate depression. Additionally, interpersonal therapy, IPT, addresses interpersonal conflicts and social stressors that may impact mood and well-being. For individuals who do not respond to initial treatment or who have co-occurring mental health conditions, a combination of medication and psychotherapy may be recommended. Antidepressant medications such as selective serotonin reuptake inhibitors, SSRIs, and serotonin and norepinephrine reuptake inhibitors, SNRIs, are commonly prescribed to help alleviate depressive symptoms by targeting neurotransmitter levels in the brain. However, it is important to note that medication can have side effects and may not be suitable for everyone. Conclusion: Transcranial Magnetic Stimulation TMS has emerged as a groundbreaking treatment option for depression, offering hope to many who have struggled with this complex mental health condition. By understanding the working principles, benefits, considerations, and alternatives to TMS, individuals can make informed decisions about their treatment options and work towards alleviating their symptoms. As research continues to advance, we can anticipate further refinements and applications of TMS, paving the way for innovative treatments for depression and other mental health conditions. Thank you for joining us on this journey through the world of transcranial magnetic stimulation. If you found this video informative and insightful, we encourage you to hit the like button and share it with others who may benefit from this information. Your support means everything to us, and we look forward to continuing to bring you valuable content on various health topics. Stay well and take care.